Okay, I have us approaching 1:15, almost 1:15, and I want to start our news conference regarding all things with COVID-19 pandemic here in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University, and we are going to start today with a special guest. President Pamela Whitten has joined us and would like to start off with a few words. President Whitten.
Thank you, Chuck. It's very kind of you guys to include me today. I wanted to drop in just to take a moment to thank all of you for really your unflagging efforts, not only prior to my arrival at Indiana University about 4 months ago through the difficulties of COVID, but also, honestly, during these past months, as IU has embarked on an academic year marked by a return to in-person instruction. And of course, if you've been around campus at all in these months, really a sense of euphoria, particularly in the aspect of students. Everyone's so happy to be back together again. I really would also like to take a second to thank all the extraordinarily dedicated healthcare workers who we all know have been and really remain on the front lines of the pandemic, as well as our many city and county partners, really for your collaborative spirit. Since the outset of the pandemic, which feels like many decades ago, I know for most of us, IU's campuses have really been amongst the safest places in the state. But one of the lessons that we've learned during the pandemic is really the degree to which all of us are interconnected. And our success, IU's success in weathering the pandemic, could not have been accomplished without the strong partnership that exists between the university, the city, and the county. And so I especially want to thank Mayor Hamilton and his staff, Monroe County Health Department Advisor Penny Caudill, and certainly her staff, Monroe County Commission President Julie Thomas, Commissioners Lee Jones and Penny Giffens, and of course, Brian Shockney, president of the IU Health South Central region, and his colleagues for their partnership as well. We are indeed fortunate in the deep and the enduring relationship that we have with this community. And I know I speak for many when I say IU and the Bloomington and Monroe County community are, in some ways, we're so inseparable, interdependent, and interconnected. And that's really, really to the betterment of Indiana University. The city and the county provide such a wonderfully welcoming environment for our students. They provide a safe, family-friendly, and stimulating community that is attractive not just to students, but also to IU faculty and staff and their families. And this is also a community that IU alumni remember with great fondness. I cannot encounter an IU alum without a story of their days in Bloomington and how much they love this community. And so, of course, as we know, many return as contributing residents in various capacities as well. So it's really the ideal place for the state's flagship residential research university. So all of us at IU are enormously grateful for the cooperation really that takes place on a daily basis between IU and the government, businesses, schools, and citizens of this great city and this great county as well. And so we look forward to even greater cooperation and participation in the years to come. So thank you. Thank you so much for letting me jump on the call today. I appreciate it.
Absolutely. Thank you very much. And thanks for marking this great partnership that we've had here. This is just part of it on this news conference every week. Thank you, President Whitten.
Thank you.
Well, with that, we will go ahead and get going with our regularly scheduled program and our opening remarks. We will start today with Mary Catherine Carmichael from the city of Bloomington.
Hi, everybody. And I would add my thanks on behalf of Mayor Hamilton to President Whitten for those very kind remarks, and spot on. Absolutely. It's been quite a great example of cooperation throughout this. Oh man, we're creeping on 2 years, people. I can't believe it, but wow, that's really something. Anyway, this has been a marathon for sure. My report's going to be pretty brief. We've only had one employee case in the last week since my last reporting. So I'm very pleased to announce that. To see these numbers come down is just so gratifying. President Whitten mentioned, in-person instruction returning. Well, this year in-person trick-or-treating, I think, is going to return in pretty full fashion. If you want to participate in trick-or-treating, City of Bloomington always acknowledges the trick-or-treat hours as 5:30 to 8:30 on Halloween. That's October 31st. This year that falls on a Sunday. So if you want to participate, leave that porch light on, or you can set a basket out. It depends on whatever you prefer. If you don't want to participate, leave that porch light off. But we just thank everybody, and stay safe while you're out there trick-or-treating. Please keep your eyes open for the kids. They're going to be out running around, and everybody knows they get pretty excited and dash and dart out into the streets. So I know that's not COVID related, but I worry every year. So just please pay extra attention, because we really love those kiddos and we want to keep them safe. Otherwise, I think you might have heard about our $600 wellness or vaccination incentive. It's no benefit if or it is a flat line of our healthcare costs for employees if you are vaccinated and can provide proof of vaccination. If not, you will see a $600 increase. We see that both as a reward and an incentive, and we hope that that works out internally. And we know that several other organizations are taking similar steps, and so we're going to give that a whirl here at the city of Bloomington. So that's all I have right now. I'll hand it back to Chuck. Thanks, Chuck.
Okay, let's check in with Monroe County Department of Health and Penny Caudill.
Thanks, Chuck. I appreciate it. And echo all the comments that have been made so far today. I want to begin today with talking about the regulation and its extension and how it expires, to try to clear up any confusion that people may have. The health regulation was extended this week, and it is extended until our goal or the metric is met. And the goal has been the same since we put this particular regulation in place this summer. Nothing has really changed significantly in this regulation. So you may ask, well, what is that goal? It is reaching less than 50 cases per 100,000 residents, and that would put us at a moderate level of transmission. And the county needs to be in an advisory level that is blue. It is possible to have one, but not both of those metrics. And so we do need both of them to be in place. The regulation, as a reminder, requires masks regardless of your vaccination status when you are in indoor public spaces. And that stems from the CDC's recommendation this summer when Delta variant started surging, that everyone, regardless of their vaccination status, needed to be masked up if the rate of transmission in a community was substantial or high. And that's where we've been. That's what led to these regulations. So you may ask, where are we? And I want to share my screen real quick if I can, because I want to show this. I want people to see what we are looking at. And can you see the map? It's always hard for me to tell what's being shown. Yes, thank you. So when you go on the state's map, there's a map filter, and lots of times what tends to pop is the weekly 2-week metric, and that looks good, right? That shows much improvement. But what you want to look at is the advisory level, so that we can see where we actually are and if we're meeting the guidelines. So this week, and you can kind of hover over the county and see, the advisory level is still yellow, because if we're dropping the metric score, we've got to show consistency. We have to be there 2 consecutive weeks before that advisory level will drop to blue. And then our cases per 100,000 did drop below 100, and that was good news. Our positivity rate is below 5%. That is good news. If we see similar numbers next week, then the advisory level would go to blue. Now, it is quite possible that we will not go to blue next week. Our numbers could bounce back up in one of those metrics. We saw that happen last spring. We were in yellow, we saw blue coming, and then we were back yellow. And it was several weeks before we really went to that blue advisory. So I caution everybody, while we're getting excited that numbers are improving, it does not mean that we are out of the woods yet. And so I will stop my screen share. So when the cases drop below 50 per 100,000 residents and we're in a blue advisory, then that night at midnight, the order would expire. And the exact time of the expiration, this map that I showed you is updated every Wednesday by 5 p.m. So that's, you'll know what's coming, and we'll have time to tell you what's coming. And when we reach the goal that's set, then midnight at 11:59 p.m., then the order would expire. And that, giving us that little bit of time, will just make sure that we can share that good news with everybody. So you may be asking, what's all this mean? Well, there are several things that it means and does not mean. Those who are unvaccinated still need to be wearing a mask. So even when we reach this goal, if you are unvaccinated, you will still need to be wearing your mask to protect yourself and others when you are in public and with other people. Whether we have a mask requirement or not, that is still the recommendation and what you need to be doing for your safety. Those people who are fully vaccinated, when we reach this goal, may still want to wear their mask. And they certainly may do that, but they would then have that option, right? So that's really what we're looking at. That goal is to go back to recommendations. When this order expires, it will not mean the pandemic is over. We still have a long way to go to get out of this pandemic, and precautions are still going to be needed even when we reach this goal. So for now, the regulation has been extended until we reach this metric, and we are not there yet. So I want to hit a little bit on what happens if you are a close contact to somebody. We've talked about this before. If you are vaccinated, mask up, monitor for symptoms, and then test between day 5 and 7 after that exposure. And that's a little bit of a change. There for a while, it was 3 to 5 days. So wait 5 to 7 days, test somewhere in there. And then if you're positive, obviously you would isolate. If you're negative, then you can breathe a little bit of a sigh of relief. If you are unvaccinated, stay home, quarantine, arrange for testing. Mask up whenever you may be around other people. So if you can't totally isolate from quarantine from other family members, make sure that you're masking up. Follow directions that you were given. 14 days of quarantine is still the gold standard, but there are some situations and ways that can be dropped to a few lower days. You could go 10 days if you've not experienced any symptoms. If you test between day 5 and 7 and are negative, then day 8, you could come out as long as you were always wearing your mask when you were around other people and continue to monitor for symptoms. So we are also in flu season. Masks, hand washing, distancing, all help to reduce the spread of other viral infections, and flu vaccinations are available now. Please get yours. And speaking of vaccinations, we reached 61% of our eligible population is now fully vaccinated for COVID-19. We're seeing many people get their booster doses at this time. Our nurses are very busy. Be patient. The vaccines are still working. We want people to get their boosters, but it is not as urgent as it is for those who have not gotten any vaccine yet to start. The homebound program continues. So if you are homebound and need your booster or an initial vaccination, you can call 211 and schedule for a homebound visit. Our nurses have been in schools. I've been talking about that. They have been offering COVID vaccine and flu vaccines. The interest in the flu vaccine has been quite high, and we're grateful for that. We are making plans to prepare for the 5 to 11-year-olds in anticipation that they will soon be eligible for vaccine as well. We will be offering school clinics, office visits. There will be mobile clinics, Pharmacies will have vaccine, and your provider will be another option for you. So when you're going for that normal well child clinic, you can get your vaccine at that time. We are planning a couple of evening or Saturday clinics, on-site school clinics, and just like we've been doing, we'll have regular clinic visits. We are requesting mobile clinics as well. So we plan for you to have lots of opportunity to be vaccinated. Stay tuned for the details. The vaccine must first be approved for this age group. It is not yet. When the CDC director gives the final okay, then we will get directions and that we can follow. Just because that approval may come on a Tuesday does not mean that vaccine will be available for that child on Tuesday. But we are preparing for that. So please, again, be patient. And in my final news, as Mary Catherine mentioned, it is Halloween weekend, and we encourage safe and fun trick-or-treating. Outside is safer than indoors. Avoid crowded spaces. A costume mask is not a substitute for a face covering or a mask. Be mindful of your pet's safety as well. Keep batteries and snacks out of their reach. Keep them safe. Let's make this a safe and fun weekend full of treats and no tricks. Back to you, Chuck.
Okay. We'll check in with the Monroe County Council. Penny, are you representing today?
I am. Thank you, Chuck. I want to remind people that the Township Assistance Fund, which was created by the Board of Commissioners and the Monroe County Council, is there to provide assistance to residents who are suffering from financial loss, especially loss as a result of COVID. This can go toward your housing costs, or either your mortgage or your rent or utilities. The fund is administered by our township trustees. So if you need help in meeting everyday expenses, please contact your township trustee as soon as possible. Every resident in Monroe County, whether you live in town, the city, or in the unincorporated parts of the county, everyone lives in a township, and you can find your trustee by calling 211 or online at in211.org. If the governor extends the emergency order, the Special Township Assistance Fund will be available for another month. If not, it will end today. If it's ended, the trustees will revert to the regular Township Assistance Fund that they had. It's not that people in need are going to have to go without anything, but it will just reduce the amount that they'll be eligible for. The Monroe County Commissioners are proud to continue to host blood drives. The next dates are November 3rd, 10 a.m. to 3 p.m. and November 5th from 2 p.m. to 7 p.m. The November blood drive will be held at the Northwest YMCA. You can go to redcross.org to make an appointment. And we want to thank both the YMCA and our Monroe County Emergency Management Department for making sure that these things continue to happen. We do have a severe blood shortage in this area, and anyone who's eligible, please sign up and help others. A number of COVID fire stations are hosting COVID-safe trick-or-treating events on Sunday evening. To see the times and locations, you can go to co.monroe.in.us and click on the emergency management page. And finally, Monroe County residents are urged to sign up for the free service, the Resident Alert Program. You can go to, again, co.monroe.in.us. Let me try that again, to co.monroe.in.us and click on the megaphone on the homepage. You'll receive updated health alerts as well as information on severe weather and road closures. You can get text alerts, email alerts, phone messages, or some combination of these. And I would assume, I'll double check with Penny Caudill here, but once the mask mandate is lifted, we'll probably have that available, that information through the Resident Alert Program as well. So it's just another reason to get signed up. That's all I have today. Thanks so much.
Okay, next check in with IU Health and Brian Shockney.
Thank you all for your continued support and attendance during these press conferences. We've been talking about the data, and there's lots of questions around concentrating on any specific details or goals. And those are important, but we need to also continue to focus on the overall goal of ending this pandemic. And that can only be accomplished through high vaccination rates. And so don't focus on the goal, don't focus on the metrics. The overall goal is let's get people vaccinated, let's end this pandemic. I'm happy to share that in the last week, we have started to see a steeper decline in COVID-19 inpatients across our region. We're also seeing a similar trend here in Monroe County between IU Health Bloomington and Monroe Hospital. Also on the screen, as you can see, our numbers of inpatients hospitalized due to COVID-19 continue to be overwhelmingly unvaccinated individuals. So it's also flu season, the seasonal influenza. While we are largely protected from a mild flu season last year and the previous year, we were wearing our masks, we were social distancing, doing those things. We are seeing a high increase in our flu inpatients across the region, those testing positive and admitted to our hospitals. Actually, a higher rate than in 2019 prior to the pandemic. Therefore, we just want to urge you to get your flu vaccine sooner rather than later. And yes, it is safe to get your COVID vaccine and your influenza vaccine at the same time. And there are lots of places you can get both at the same time. Additionally, I'd like to share our support of the Monroe County Health Department and community in the decision to continue the mask order until we are truly at a safe level of COVID cases in our community. While I recognize that masks continue to be an inconvenience at times, and we are all ready to get rid of those masks, I appreciate the intentionality to ensure we are removing the mandate at the right time to ensure we keep our community safe. And it is important to note that Monroe County is the only county in Indiana with a mask mandate, a county health order still in effect, and is leading many of our other counties in weekly progress, and only one of 4 counties leading the way in the positivity rate declines in this week's report on the State Department of Health website. So as Administrator Caudill stated, we need to focus on the advisory level. That's where we really need to focus on, and that is going to be in stopping the spread, getting vaccinated, and reducing our numbers. And we're just not there yet. But this is a great start. It's a great trend, and we look forward to everyone helping us get out of this pandemic. I'm happy to take questions at the end.
Okay, let's next check in with Indiana University and Kirk White.
Hey, good afternoon. Good numbers to report this week on the COVID front. Certainly, our vaccination rate has continued to increase. You might remember last week we were at 93.7%, and this week we've moved up to 94.1%. At the same time, our cases of COVID have continued to decrease. So last week we had 25 cases. This week we only had 20. That's the lowest we've had all semester. So you see, as the vaccination rate goes up, the infection rate goes down. And this is a good indication of why it's important to get that vaccine or get a booster when you need it. And the one number that we have talked about, both Brian and Penny have talked about today, is influenza. And we're starting to see some influenza cases on the campus, just like in the community. So it's important that not only are we mindful about COVID, but also influenza, because as you know, all along, our goal here is to keep infections down, keep people well, so that we don't add any more demand to the healthcare system, and they can continue to take care of those people who have other needs. If we can prevent them, that's a good thing. So along those lines, Indiana University is going to have a joint Moderna and influenza vaccine clinic. This will be held on November the 7th. That's a Sunday from noon to 5. And I'll put a link here in the chat. It's easy to go online if you're IU students, faculty, or staff. There's details at this link. Go online and make an appointment from noon to 5 on November 7th. You can either get your first COVID vaccination or you can get your third in the form of a Moderna vaccine. And as well, you can get your flu vaccine that day as well. It's all free. So we're happy to be able to provide that for our students, faculty, and staff, and encourage everybody to do so. So with that, that's our update. I'll be ready to answer any questions.
Okay, we do have some questions already from Dave Askins, the B Square Beacon, for Mary Catherine Carmichael. From your description today, it sounds like the $600 figure associated with vaccination is not exactly a bonus. It sounded more like getting vaccinated is a way of avoiding an extra new $600 charge. Is that a fair description?
Well, I would say if you are a City of Bloomington employee, your health insurance will increase by $600 if you're not vaccinated.
Okay, and then there's another part of this question. Also, last week, the mayor reported a 4-point increase in the city employee vaccination rate. Is there any additional progress on that front?
You know, I just checked with HR to get that information, and they did not have that available yet. If you want to check back probably Monday, Dave, I'd be happy to get that for you. Then we just don't have it today.
Okay, another question for Dave, for Penny Caudill. Based on the first 4 days that will go into the weekly per capita circulation for next week, any chance of hitting 50 cases per 100,000 in population has been mathematically eliminated. And just to stay under 100 cases per 100,000, we need to average just around 12 cases a day for Friday, Saturday, and Sunday. That seems like a slim chance. Is there any theory to account for this local uptick over the last 4 days, or should we think of this as the normal sawtooth pattern to a decline?
Short answer to your question is I would see it as a sawtooth. As I kind of mentioned earlier, when we were in this same situation last spring, the numbers dropped below 100 and then they went back up, and then we were there a few weeks before it came back down. So we do see that up and down. I agree with you. I've looked at the numbers, and there's a good chance we will be over 100 cases per 100,000 next week. We might slide in there in the upper 90s. It does all depend on what happens, but it is expected, and I hope that that's what people understand. This week's numbers are good, and we're pleased with those. But it does not mean that we are, we're out of the woods, right? It is going to take a while for us to really get there. And to reach that goal and be under 50, I think we'll have to have like 10, no more than 10 cases a day. So that's going to take a while to get there when we are right in those upper 20s, right around 20, I think now per day that we are seeing. So I do anticipate that it will take us several weeks to reach that goal that we've set. I don't think it will happen next week, and I think it's just the normal progression of things.
Another question for you, Penny, from Holden Absher from WFIU, WTIU. Can you address where COVID-19 boosters are available in Monroe County, and do people need to sign up ahead of time?
Certainly. So ourshot.in.gov has all the places that you can go to get vaccine, and your booster should be available any place that you can get the initial vaccination started. So your local pharmacies are options. Your provider may have it for you. The public health clinic has it. We've expanded ours. Again, that is a partnership between the County Health Department and IU Health, and we are working our nurses to the bones, trying to make sure that we have lots of vaccine opportunities available, and we will continue to do that. And that reminds me, I've talked to you before about the Indianapolis Motor Speedway and the testing and vaccination that is available, and the State Department of Health announced they have extended that through the month of November. So if you want an experience, you can go to the Indy Motor Speedway and you can get that booster, your initial vaccine, or you can get tested, whatever it is that you need.
to be clear, that's not done in a moving Indy car, correct?
You are correct. It is not. That would be, well, not getting your shot would be fun.
That's
but,
an experience.
Yes.
Next question for Kirk White from Patrick McGurr from the HT. Does IU have any additional method to determine the share of vaccinated students, faculty, and staff beyond their attestation? What happens if someone is found to have lied on their COVID-19 self-report form? What kind of consequences could they face?
Well, Patrick, that's a good question. We do ask that people submit their forms if they prefer to do that. But if they just want to sign the attestation form, that's okay too. But they're signing a document that has their signature on it, and they are attesting that they have either been vaccinated or have a medical or religious reason for an exemption. So if it's found that they have falsified that document, they are subject to university sanctions, either for students through our student affairs department. For staff, it's through our human resources department, and for faculty, it would be through faculty affairs. The same kind of sanctions that you'd be able to have if you violated or lied on any other university form that you're asked to complete as part of your obligations of agreements to be a student, faculty, or staff member.
Waiting on other questions here, but here's one from Patrick for Penny and Brian. For how long is the window in which flu and vaccines can be administered at the same time? If you wait 2 days, hypothetically, would you then have to wait further? Flu and COVID vaccines, he adds here.
You can get both of them at the same visit at the same time. So if I went into my provider today, I could get my COVID vaccine and I could get my flu shot in that same visit.
And Chuck, I would add that at our clinic on November the 7th, you can get them both at the same time, maybe different arms, but you can, it's a full service operation on November 7th.
And to be clear there, could you literally get them both at the same time, like one arm? Could they time it up? That would be something too. I'm full of ideas that will not be implemented here today.
Make a request like that, we'll work on it.
Yeah, I have already had my flu, only need the booster, so I would not be eligible. So as we wait for any other questions here, we'll make a programming note. So we will be going back to every other week for this news conference after next week. So we will meet here next Friday at the same time, 1:15, and then we will do every other week following that. So you can do the math on the calculations. So November 5th, and then 14 days after that, we will return to do updates as we hopefully have entered a slower period regarding the pandemic. That is our fervent hope. So waiting here again for another question, if there is one. If there is not, we will go ahead and wrap up the proceedings for this week and return again next Friday. Seeing none, we will end it there, and we will see you next week.
Thank you, Chuck, for your support.
Thank you.